Heart failure is not a sudden collapse or heart attack, it's an exhaustion. Heart failure doesn't mean the heart has stopped working. It means that the heart can no longer keep up with the body's demands. The engine is still running, but it's running tired. For years, the heart adapts. It pushes harder against pressure. It wakes around scars from old injuries. It fills in under a higher volume. At first, adaptation looks like survival, but adaptation is expensive. Over time, the heart's efficiency declines, it fills poorly, or it pumps weakly, and slowly, quietly, fatigue sets in. Sometimes the heart becomes stiff, it cannot relax enough to fill. Other times it becomes weak, it cannot push the blood forward effectively. Different paths, same destination, not enough blood reaches where it's needed. Here's something surprising. Diabetes doesn't just affect blood sugar, it changes how the heart uses energy. High glucose stiffens the heart muscles. It damages tiny blood vessels. It disturbs fuel use inside heart cells. Even without blocked arteries, the diabetic heart becomes less flexible, less efficient, more vulnerable to fatigue. This is why diabetes is one of the strongest drivers of heart failure worldwide, not loudly, but relentlessly. And you might wonder why fluids accumulates around the lungs in such a case. As the heart tires, blood retaining to it begins to back up. Fluid seeps into the lungs, into the legs, into the abdomen. Breathlessness, isn't it weakness? Swelling, isn't it just water? There are signs of congestion, traffic backing up behind a tired pump. So when it comes to treatment, it doesn't force the heart to work harder. It does the opposite. Some medicines reduce pressure ahead of the heart. Others help the body shed excess fluids. Some slow harmful signals that exhaust heart cells. Nowadays, we use diabetes medicines which interestingly protect the heart. Even in people without diabetes, the goal is not to strengthen the heart aggressively, but to reduce the burden it carries. One of the most powerful treatments for heart failure is not pushing harder, it's pacing. Balanced movement, constant routine, respecting limits. Rest used wisely becomes medicine. So heart failure is not a failure of will, it's the final chapter of long-term stress. In the next chapter, we will talk about what happens when the heart loses not strength, but rhythm. So stay tuned with Dr. Naz, your pocket clinical pharmacologist and pharmaceutical scientist.